Hello everyone, this is Dr. Grantika, ENT resident at RIMS Raichur. Today we are going to learn about the effect of smoking on nose. To begin with, the nasal cavity of nose is lined by respiratory epithelium, that is olfactory epithelium and transitional epithelium, which is not shown in the picture. Nasal cavity is mainly lined by respiratory epithelium. There is pseudostratified ciliated columnar epithelium. As the name says, it contains ciliated columnar cells. As you can see in the picture, it has ciliated cell which has cilia and goblet cells which secrete mucus and basal cell. The cilia helps in mucociliary clearance. What is mucociliary clearance? Mucociliary clearance is a primary innate defense mechanism against infections, and it prevents obstruction of the airways. And the inhaled particles like dust or pollen are trapped by mucus produced from goblet cells. Goblet cells secrete mucus, forming a mucus layer and trap inhaled particles. The beating hair-like structure, that is cilia, then move this mucus and trapped particles out of the airways, that is towards the pharynx, where it can be swallowed or coughed up. This is called mucociliary clearance. Smoking causes impairment of mucociliary clearance as tobacco contains hundreds of noxious chemicals. When smoked, can irritate the lining epithelium of the nose and causes a reduction in the number of cilia and change in mucus viscosity, resulting in increased nasal secretions and congestion due to impaired mucociliary clearance. Eventually, it will cause mucus plugging, that is accumulation of mucus, which can lead to airway obstruction and difficulty breathing. And it also causes increased risk of infections due to buildup of mucus. It can provide a breeding ground for pathogens. It also causes sputum production due to impaired clearance, which can lead to production of large amounts of thick sputum, which can be difficult to clear. And it can also cause various respiratory problems, including chronic infections, airway obstructions, and lung diseases, COPD, that is chronic obstructive pulmonary disease, and asthma and cystic fibrosis. And studies have shown that just after 8 hours of smoking or the exposure to tobacco smoke, the efficiency of mucociliary clearance had reduced. Now you can imagine how marked the impact will be on heavy smokers. So stop smoking now and take care of your health. Thank you.